Imagine feeding your horse the same alfalfa hay you have fed countless times before. It looks green, it smells fresh, your horse begins eating normally. But hidden inside one flake are the crushed remains of several small beetles and a toxin powerful enough to cause severe colic, kidney damage, shock, and even death. These insects are called blister beetles, and the toxin they carry is called cantharidin. Although blister beetle poisoning in horses is considered relatively uncommon, every horse owner who feeds alfalfa should understand the risk. The beetles can be difficult to detect. Their toxin remains dangerous even after the insects are dead, and there is no specific antidote. So, what do blister beetles look like? How do they get into horse hay? What are the first symptoms of cantharidin poisoning? And most importantly, what should you do if you believe your horse has eaten contaminated alfalfa? In this video, we are answering those questions and explaining how horse owners, barn managers, and hay producers can reduce the danger. Before we continue, remember that suspected blister beetle poisoning is a veterinary emergency. This video is intended for education and should never replace immediate advice from a veterinarian. Blister beetles are long, narrow insects belonging to the family Meloidae. Depending on the species, blister beetles may be solid black, gray, brown, metallic, or marked with distinctive stripes. Many adults measure approximately 1/2 to 1¼ inches long. They generally have elongated bodies, prominent heads, narrow necks, and relatively long antennae. Their name comes from cantharidin, a defensive chemical capable of causing painful blisters when it contacts skin or delicate tissues. For horses, however, the greatest danger is not usually a living beetle crawling across the pasture. The greatest danger is a dead or crushed beetle hidden inside alfalfa hay. Adult blister beetles feed on the flowers, pollen, and leaves of plants, including blooming alfalfa. Some species gather in large groups or swarms. If one of those swarms enters an alfalfa field during harvest, many beetles can be crushed by cutting, conditioning, or crimping equipment. Instead of escaping as the hay dries, the dead insects may remain trapped inside the window and eventually become compressed into a bale. This creates an especially unpredictable form of contamination. One section of a bale may contain numerous beetles, while hay from the other side of that same bale may contain none. A horse could eat apparently normal hay for several days before encountering the contaminated portion. The beetles do not have to be alive to poison a horse. Cantharidin remains toxic in dead insects, and according to veterinary authorities, its potency does not disappear simply because the hay has been stored. This means that leaving suspicious hay in the barn for several months will not make it safe. Cantharidin is colorless, odorless, and intensely irritating. When a horse chews and swallows contaminated hay, the toxin may damage tissues throughout the mouth and digestive tract. After being absorbed, it can also injure the urinary system, including the kidneys and bladder. The severity of blister beetle poisoning depends on several factors: the species of the beetle, the concentration of cantharidin, the number of beetles consumed, the horse's size and condition, and how quickly treatment begins. There is no dependable number of beetles that can be considered safe. Cantharidin levels vary dramatically between species and even between individual beetles. Some beetles contain far more toxin than others. That uncertainty is precisely why visible blister beetles in hay should never be ignored. The first symptoms can resemble other equine emergencies, particularly colic. A horse may become restless, paw the ground, look repeatedly at its flank, lie down, roll, or refuse food. But blister beetle poisoning can produce additional warning signs. The horse may develop sores or blisters inside the mouth or on the tongue. It may repeatedly place its muzzle in water or attempt to drink small amounts because the mouth and digestive tract are painfully irritated. Owners may also notice excessive salivation, depression, sweating, diarrhea, an elevated temperature, dehydration, or a rapid heartbeat, or faster breathing. One of the most important warning signs is frequent or painful urination. The horse may repeatedly posture as if trying to urinate, while producing only a small quantity. Blood may appear in the urine. Because these signs can sometimes be confused with ordinary colic, bladder problems, or urinary stones, the possibility of contaminated hay must be mentioned to the veterinarian. Some affected horses develop low blood calcium or magnesium levels. This can contribute to muscle tremors, weakness, abnormal heart rhythms, or a stiff and unusual gait. In severe cases, the toxin can cause extensive intestinal injury, kidney damage, shock, collapse, and death, sometimes within hours. If your horse develops colic, repeated attempts to urinate, mouth irritation, or unusual drinking behavior after eating alfalfa, call your veterinarian immediately. Do not wait for every possible symptom to appear. Do not assume the horse simply needs to be walked for a while, and do not give medications, mineral oil, activated charcoal, or other treatments unless a veterinarian specifically directs you to do so. Remove the suspected hay, but preserve a representative sample and keep the bale, lot number, supplier information, and any visible beetle fragments available for investigation. Prevent every horse in the barn from eating hay from the same batch until your veterinarian or another qualified professional has been evaluated the situation. If several horses have eaten the hay, monitor all of them closely and tell the veterinarian exactly how many animals may have been exposed. Diagnosis may involve the horse's symptoms, physical examination, blood tests, urine testing, and analysis for cantharidin. Urine samples are especially time sensitive because detectable toxin levels may fall after the first several days. There is no specific antidote for cantharidin poisoning. Treatment is supportive and must begin as quickly as possible. Depending on the case, a veterinarian may use intravenous fluids, pain relief, gastrointestinal protectants, activated charcoal or mineral oil, and correction of calcium and magnesium abnormalities. Kidney function, hydration, heart rhythm, urine production, and signs of intestinal damage may require careful monitoring. These decisions belong to a veterinarian because an affected horse can deteriorate quickly, and treatments appropriate for one case may be unsafe for another. The prognosis depends heavily on the quantity of toxin consumed, the extent of organ damage, and how soon treatment begins. Horses surviving the initial period without major complications generally have a progressively better outlook, but suspected exposure should always be treated seriously. Preventing blister beetle poisoning begins with knowing your hay. Ask your supplier where the alfalfa was grown, when it was harvested, which cutting it came from, and whether the producer scouts fields for blister beetles before cutting and baling. Risk varies by region and season. Blister beetles are frequently associated with warm, arid areas where grasshopper populations are common because the immature stages of certain blister beetle species feed on grasshopper eggs. Earlier cuttings may carry a lower risk in some locations because adult beetle populations often increase later in the season. However, no cutting, region, or appearance can provide an absolute guarantee. Hay producers can reduce risk by regularly scouting alfalfa fields, controlling flowering weeds, paying attention to grasshopper activity, and stopping harvest if blister beetle swarms are present. Allowing a swarm time to disperse can prevent the beetles from being crushed and trapped in the hay. Harvesting methods also matter. Equipment that cuts and crimps the alfalfa in a single operation may crush insects before they escape. Chemical control alone does not necessarily solve the problem because dead beetles can still be swept into the windrow and baled, and dead blister beetles remain toxic. For horse owners, careful inspection is useful, but it has its limitations. Look through flakes as you feed. Watch for elongated black, gray, brown, or striped beetles, and for clusters of crushed insects' bodies. If you find suspicious insects, stop feeding the hay immediately. Do not simply shake out the visible beetles and continue feeding the remaining hay. Cantharidin may be present in crushed fragments that are extremely difficult to see, and contamination may be concentrated in isolated sections. Contact your veterinarian, local agricultural extension office, or a qualified entomologist for help identifying the insects. Notify the hay supplier as well so other potentially affected customers can be warned. Remember, not every beetle discovered in hay is a blister beetle. Correct identification matters, but when your horse's safety is involved, caution is far better than guesswork. Blister beetle poisoning demonstrates why hay should never be judged solely by its color, smell, protein level, or price. Safe forage also depends on how the crop was grown, inspected, harvested, and stored. The essential facts are simple. Blister beetles contain cantharidin. They may enter alfalfa when swarms are crushed during harvesting. Dead beetles remain toxic. Poisoning can cause mouth lesions, severe colic, repeated drinking or urination, diarrhea, weakness, kidney injury, shock, and death. There is no specific antidote, so rapid veterinary treatment is vital. This does not mean horse owners should panic or automatically stop feeding alfalfa. Contamination is uncommon, and alfalfa can be a valuable source of energy, protein, calcium, and quality forage when it is appropriate for an individual horse. It does mean we should know our suppliers, understand regional risks, expect hay carefully, and take suspicious insects or unexplained symptoms seriously. A blister beetle may be small, but the toxin it carries can have devastating consequences. Awareness gives us the chance to recognize the danger before a contaminated flake reaches the feed bucket, and to act accordingly if something goes wrong. If you found this video helpful, share it with another horse owner, barn manager, or hay producer. A few minutes of awareness could help save a horse's life. Thank you so much for joining us. And remember, I am not AI. If you listen closely, you can hear me breathing. Also, remember, we are not veterinarians, and you should always consult your veterinarian if you feel that your horse has eaten a blister beetle.